One of the most common times for back pain to be at its worst is in the morning, and that's because after a night's sleep, the inflammation within the lower back has really had a chance to kind of set in, and that inflammation can start to push out and press onto some of the tissues and the nerves and the structures all around in the lower back, and that can create pain. So what I want to do is give you a quick fix on how to free yourself up so you can then get up and get on with your day. So what we're going to do is start off lying in bed, and we're going to set our pelvis up so it's nice and neutral, and then I'm going to gradually tilt my pelvis forwards into this position and then roll it back towards me. So I'm just moving my pelvis back and forth, and you'll feel your lower back going into a flex position as I roll it up, and an extended position as I roll it down. Now, I'm going to try and do this movement as smoothly as I possibly can do, so it's nice and gradual, and wherever I feel any pain, I'm going to stop at the barrier of that discomfort. So I'm going to do this maybe 20 or 30 times, and what you're going to find is as you do this, it's going to start to free up, and you'll be able to take it a little bit further without moving it into any pain at all. From there, I'm then going to take my back into kind of a neutral spine, where my lower back is just gently arched off the bed. And from there, I'm then going to take my pelvis from side to side. And again, just moving up to the barrier of any discomfort or pain, and then backing away from it. Again, that movement's going to be nice and smooth and gradual, side to side, and again about 20-30 times. From there, I'm going to try and couple this movement in with the side-to-side movements, and this is going to create like a rotational movement around my pelvis. So I'm going to take my pelvis and lift it up off the couch, rotate it round, and then push it back. And again, if I experience any pain through that circular motion, then I'm just going to move up to the barrier of discomfort and then try and find my way through without pushing into any pain. I'm going to take this through an anti-clockwise direction, and again about 20 to 30 times, and then go back the other way 20 to 30 times. From here, I can then roll onto my side, swing my legs out over the side of the bed, and then bring myself into a kneeling position here. And then from that position, I'm going to do the same movement. So I'm going to then take my pelvis into an anterior posterior pelvic tilt, nice and gradually moving up into any pain and then backing away from it 20 to 30 times, bring myself into a neutral spine position and then going from side to side. Then I can couple the two movements together and create a rotational movement just as I did on my lower back in both directions. That should just get some of the inflammation pumped away from the lower back and get you started moving again. So good luck with that, hope that helps.